The events surrounding the Ebola diagnosis of Thomas Eric Duncan last October at Texas Health Presbyterian Dallas forced local leaders to develop a somewhat spontaneous plan of attack using the protocols available.
When you're using something that's designed for one purpose for another, it's not going to be perfect.
Officials did contain the virus to Duncan and 2 nurses who treated him, despite identifying scores of people who had come into contact with them. Duncan died, but the 2 nurses have been declared Ebola-free.
We don't want to just craft the changes in the law to deal with Ebola, but to deal with other infectious diseases that may come to our shores, because we are an ever-shrinking global community.
Jenkins sees 3 main areas lawmakers can address in the 84th legislature. Number 1, simplify the process of hazardous waste disposal. Jenkins said the county and state had to deal with lots of red tape to properly get rid of contaminated materials. Number 2, stronger enforcement to keep contagious people confined. Right now, a person has to violate an order from the state health director before he or she can be taken to court to be forced to stay put, an action that had to happen to restrict the activities of people who had come in contact with Duncan.
We had a few people who were a little less compliant than others, and that's where those challenges come in.
And finally, Jenkins said lawmakers need to look at medical confidentiality laws to clarify how a list of potentially infectious people can be legally disclosed to those who need that information. It comes down to balancing personal privacy with the public's right to know, allowing first responders to have the most up-to-date and pertinent information in an emergency when dispatched to a location. The chairman of the Senate Health and Human Services Committee, Charles Schwartner, says he will file a bill based on input from Dallas County and recommendations from the newly created Texas Task Force on Infectious Disease and Preparedness. The legislation would give the governor the power to declare a state of infectious disease emergency.
It's a big priority. People don't think of infectious diseases until there's one out there. And these are high priority, deadly, and contagious diseases that we're talking about. We need to handle these differently than an emergency disaster declaration because of how fast disease can be transmitted.
This is one of those issues that spans partisan and ideological lines. No one wants for us to be unprepared for a public health emergency, and so everyone will work together to get this done.
And with the next health emergency impossible to predict, time is of the essence. In Dallas, this is Alana Rocha reporting for the Texas Tribune.